Hi, my name is Kristen and I'm a physical therapist. To address your question on how to utilize crutches, the first thing I wanted you to do is to make sure your crutches are adjusted properly for you. So you're going to take both crutches and put them up under your arms, and what you want is 2 finger width between the top of the crutch and your underarm, the axilla, on both sides. So 2 finger widths under the arms. Then with your arms extended, I want you to extend your arms straight down, and the arm hand rests should lie at about where your wrist is, right about there when they're extended down. So when you actually use the hand rest, you should have a slight bend in your elbow, because you never want to rest on the arms, the crutches like this under your arm, because you'll put a lot of pressure on the nerves under your arm. That will cause you some trouble down your arms. You want to utilize your arms to support your weight. So the first thing I'm going to show you is if you're completely non-weight bearing on that injured foot, I'm going to pretend the non-weight bearing part is my right foot, which means my right foot or my right knee is so painful I can't put any weight on it. So what I want you to do is utilize the crutches to support your weight. And you're going to use your arms the whole time. So you're going to put the crutches out and jump. And as you get stronger and better, you'll be able to go fast. But what I want you to do is to just take your time so you don't run the risk of falling. As you begin to be able to put a little bit of weight on your foot, your crutches are going to go out with the injured foot. So again, my right foot is injured, and you're going to put as much weight on that foot as you can tolerate. But again, the injured foot goes out with the crutches. And once you're zipping around pretty good like this and you can tolerate more weight on your foot, I'm going to have you utilize just one crutch. And the crutch goes in the opposite hand of the involved foot. So the opposite hand, the crutch, and again, the injured foot still go together as you walk. Because you really should not be walking without a crutch until you can walk without a limp. Because when people walk with a limp, it causes more problems in their hips and backs that can complicate your situation. So the crutch goes with the involved foot. I also want to show you how to go up and down stairs. So the rule of thumb with stairs is to go up with the good foot first and down with the bad foot. So again, it's my right foot that's injured, so I'm going to come up the step and push up, and then utilize my crutches that way. And to go down, I'm going to have you, the right foot, because that's the involved, goes down first and then step down. So the good foot goes up first and the bad foot comes down first. I hope that addresses your needs. If you have any other questions, feel free to contact us. Be well.
Bandaging. For this procedure, you will need gloves, a dressing for the wound, a bandage, either gauze, elastic, or fabric in an emergent situation, and tape or clips to secure the bandage. As you walk in, provide for privacy. Verify the client's identity. Explain the procedure. Wash your hands and don clean gloves. Determine the need for the bandage. Will it be used to cover a wound, hold a dressing in place, apply pressure, support a wound or limb, maintain circulation, decrease edema? If the need is to control bleeding and the risk of hemorrhage exists, the nurse must apply a pressure dressing immediately. Begin by removing the old bandage. Assess the client's neurovascular status at the site and the body part distal to the wound or incision. Check the pulse, capillary refill, skin color, warmth, and sensation. Assess the skin integrity. Check for dryness, fragility of skin, and any apparent breakdown. If the skin around the existing wound shows signs of redness, swelling, bleeding, or infection, this breakdown must be treated before bandaging. Apply the bandage. The technique will vary depending on the area of the body to be bandaged. Hold the roll of bandage in your dominant hand, with the loose end on the distal portion of the area to be bandaged. This end is held with the other hand. Unroll the bandage proximally, applying slight tension as you wrap around the body part. The first 2 or 3 turns of the bandage should overlap the loose end to secure it. The bandage roll may be transferred from hand to hand. It should be wrapped evenly and firmly. Take caution to avoid wrapping the bandage too tightly. An uneven or tightly wrapped bandage can create a tourniquet effect, reduce circulation, or cause nerve damage. Here are some common bandaging methods. The figure 8 is used for bandaging joints and providing immobilization. Anchor the bandage at the center of the joint. Ascend obliquely in a circular movement around the extremity above and below the joint, in a figure 8 fashion, overlapping until the necessary immobilization is attained. Secure the end of the bandage. The spiral is used to cover cylindrical body parts. Anchor the bandage at the distal aspect with 2 or 3 circular turns. Then proceed upward or downward, overlapping 1/2 to 2/3 the width of the bandage with each turn. Secure the end of the bandage. The reverse spiral is used to cover cone-shaped body parts, such as the forearm and lower leg. Anchor the bandage at the distal border with 2 to 3 turns. Advance the roll of bandage proximally at about a 30-degree angle. Halfway through each turn, fold the bandage toward yourself and continue in a downward fashion. Continue bandaging proximally in this manner until the area to be bandaged is covered. Then secure the end of the bandage. After bandaging, assess the client's circulation to make sure the bandage is not too tight. Inform the client to notify you if the bandage gets too tight or if swelling increases. Encourage the client to elevate the bandaged limb to decrease edema. Perform periodic assessments and neurovascular checks frequently. Remove your gloves and wash your hands. Finish by documenting the procedure and the client assessment.
My name is Av Rios, and I'm a paramedic with Lansing Mercy Ambulance on behalf of Expert Village. In this clip, we're going to go over splinting collarbone injuries and also shoulder injuries. Going to be helping me is my partner Jacob Barber, who works with me at Lansing Mercy Ambulance, and he'll be doing this on behalf of Expert Village. It's pretty hard to differentiate whether or not it's the collarbone that's fractured or the shoulder, since they're both going to cause a lot of pain when the patient tries to move their arm. So what you want to do is just assume that it's probably the collarbone, since the shoulder itself is a pretty strong bone. So what you want to do in this situation is use anything, like I have a triangular bandage here, or you could use something such as a bandana, or you could even cut a piece of cloth, as long as you have it in this type of shape right here. What I like to do is take the top corner of my triangle, and I like to tie it into a knot. What this is going to do is form a pocket for the actual elbow to rest in. What I then want to do is have the patient put their arm in a position of comfort. Normally, when you have a shoulder injury, this is the type of position that you're going to find the patient in. What you then